Hello and welcome to Med Talks with Dr. Moin. Today we have renowned physician Dr. Mohan with us. Dr. Mohan, who is a professor medicine in Deccan Hospitals, and he is a senior consultant physician at Care Hospitals. So we are lucky to have him here with us today. And Dr. Mohan is going to talk to us about fever. We have heard about many seasons like summer, winter, rainy, and what else. And there is another season called fever season.
As you rightly said, seasonal, non-seasonal fevers are there. Seasonal and non-seasonal. There are some fevers which come at any time they like.
Right.
There are some fevers which are limited to a particular season.
Right.
Especially when we talk about seasonal fevers, usually we come across these kind of fevers from the month of June, July, August, September, where the rainy season is rampant. Especially the last few months, we had a tough time in entire Telangana and Andhra.
Right.
We had floods and all those stuff.
Right.
This is the season where you get seasonal fevers.
Okay.
But then there is perennial fevers which can occur any time. They are non-seasonal fevers.
Okay.
So they are related to one season, one no season.
Right.
So when season changes the entire atmosphere, the weather temperature comes down, and the lot of water accumulation is there all around in houses and streets and all. Small collection of water can invite the breeding of the mosquitoes, and there are some mosquito-borne fevers which are more rampant during this season. Then again, there are some viruses which grow when the dampness is there.
Okay.
So the non-seasonal fevers are the regular any season that can come. And then when mosquitoes are there, the diseases like malaria and dengue, which are mosquito-borne diseases, they are very common.
Okay.
So these are the two types that you are talking about.
Yeah. Sir, let's talk about seasonal fevers first.
Okay.
So when we talk about seasonal fevers, what are all the fevers you come across?
Yeah. Usually the common flu, that influenza viral infections are very common during the seasons.
Right.
Usually they are self-limiting diseases, as you know, and they don't require any major treatment. Just give the patient some rest, adequate fluids, some paracetamol and something like that, and be done with it. They are self-limiting diseases. They disappear in 3 or 4, 5 days.
So there is a saying that you treat viral fever. If you treat it, it will go in 1 week. If you don't treat it, it goes in 7 days. Is that true, sir?
Yes, we used to say this to our students also, which means whatever you do, it will take its own time. That's 5 to 7 days.
It's going to stay for a while.
Exactly. So that is one aspect of this viral fever. It's self-limiting, don't require any treatment. But there are some diseases, viral diseases, which can be life-threatening.
Okay.
You must have heard, as a doctor, you must have heard of some patients getting 1 day fever and 2nd day headache and 3rd day vomiting and 4th day no more.
No more.
So, though they are self-limiting, simple viral diseases,
there are dangerous as well.
Yes, you cannot take all of them for granted.
Right.
You know, meningitis, encephalitis, they can kill, especially pediatric patients. They die just like that in 2 to 3 days. Yeah. So therefore, one has to keep the eyes, ears, mind, everything open when you are dealing with fever. Fever is the most difficult part for physician to treat.
Right.
Many people come to us saying that I have fever. What could be the reason, Doctor Saab? Kya ho sakta hai?
Right.
So most of them, we really don't know what is the cause unless we do some investigation.
Sir, before you investigate, let me ask you a question. What is fever? Like, what temperature do you say is fever? Above 100, or you have some numbers there in Fahrenheit and centigrades?
Exactly. That's a very common question that many people do ask us.
Sir.
You know, fever, there is no fixed one number.
Right.
Just like pulse rate, there is no pulse rate. It differs from person to person. BP also differs from person to person.
Yeah.
Fever, there is no fixed range.
Okay.
It is from 36.5 to 37.3. That is the normal temperature. Normal temperature. That again we have a circadian rhythm. Circadian rhythm means it changes from
day to night.
Yeah, time to time, morning to evening. Evening, even if it is 99, you don't call it as a fever.
Okay.
Many people call us and say, doctor, we have temperature, it is 99 in the evening.
Okay.
So it's not a fever, don't worry, we check again.
That is temperature, which is normal, again not fever.
Yes.
Right.
So there's a circadian rhythm. If you are coming from outside in a hot season, your thermometer may show a couple of degrees, couple of points more than normal.
Oh.
So there are some physiological variations which are supposed to be normal during pregnancy, during exercise, evenings, Somebody's basal metabolic rate is more.
Okay.
So even when you are getting angry,
Okay.
both garam ho gaye hote. That means even when you are getting angry,
Doesn't have fever, but garam ho gaye.
yeah, when you are getting angry, your temperature tends to go up, which is all not considered a fever, you know.
Yeah.
So fever, when you want to say something fever, you have to have two recordings at least
Okay.
to fulfill the criteria of definition of fever.
Above what degrees of
About
Fahrenheit or centigrade?
37.3.
Centigrades.
37.3 persistently, not one recording. That is the fever.
Okay. Sir, somebody has fever. Should he directly take a tablet? Should he directly pop a pill? Or should he come to you, and what do you do when he comes to you?
Yeah, that's a common thing. The patients call us and say that, Dr. Saab, I have got fever, I have already taken some tablets, some paracetamol, some name they say. Whether to treat fever, is it a disease? So should we really treat fever? That's a big question. Fever itself is a protective mechanism.
Defensive mechanism in the body.
Defensive protective mechanism. When your body temperature goes up,
Right.
that means it is trying to fight the disease, fight the viral or bacterial infection.
Right.
So fever is good
Right.
and bad also sometimes.
Okay.
But that's why we don't treat all fevers. Mild fevers you do not treat. Just
Right.
give plenty of water to drink and keep the fan on. And if the patient has chills, use the blankets. But fever per se, if it is minor, you need not worry, you do not treat. So let fever be there for a day. If it is not subsiding in a day or two, then you can start anti-fever tablets like paracetamol and things like that.
Okay. Sir, when somebody has a fever, seasonal fevers, what are all the things they should look at? For example, somebody has a fever, and how do you treat them? By doing some blood tests and all?
Yeah, firstly, when to fear the fever? That's the question. When to fear the fever? If the patient is in extremes of age,
Right.
if the patient is a child or if the patient is very old, you should really worry about this fever.
Okay.
Young people, the toleration capacity is more.
Okay.
So therefore, young people tolerate better than the extreme of age group people.
Okay.
So any fever, also high fever,
Okay.
you should not take it easy. Any fever with severe headache and vomiting, any fever with giddiness,
Right.
altered sensorium, which means they are unconscious, they are semi-conscious, they are drowsy.
Okay.
So these are the indication, these are the red flag signs that you should be careful with.
Okay.
So these patients, you have to take these patients to a hospital or a doctor as early as possible.
Thank you, sir. That is something very important and informative. There are red flag signs. You may not know what is a red flag sign, but whenever there is a fever, I think you should always consult a physician. Somebody has malaria. How do you manage them, and what do you advise?
Yeah, malaria is again a tricky question. Malaria usually, they say, presents with fever with chills and right. The patient will have, I've got shivering and all.
Okay.
But again, it's difficult part for physician is that all shivering, all chills patient need not be
May not
malaria.
be malaria.
And all malaria need not present with chills.
Right.
That's the complexity of medicine, our field. 2 + 2 is not 4 always in medicine. That is one point. When you confirm malaria, if patient is coming from a place where malaria is very common,
Right.
or in their locality, somebody in their family is having malaria, and your patient also is having features which are suggestive of malaria, even if you don't do the test, you are right, you are entitled to treat with anti-malarial drugs.
Even without the test?
Yes. But again, if you really want to confirm, you can do a simple blood test for malaria.
Okay.
But the sad part of this test is, even if malaria is present, your slide test may be negative sometimes.
Because the parasite is not into the blood at that time.
Exactly. So if you really want to prove that it is malaria by blood test,
True.
every 6 hours for 48 hours, so many times you should see, then only you can say that it is not malaria.
Okay.
So in the meantime, if you are suspecting malaria, if the patient is coming from an area where malaria is very common, rampant, you can give treatment because malaria is some 3 to 5 days treatment and
Exactly.
very simple, there is not much of side effects.
Okay.
So that is malaria.
There are different types of malaria, I heard, like vivax, falciform, right? Sir, is the treatment same for all these subtypes of malaria?
Again, treatment is a little different because malaria is a simple disease and malaria also a killer disease.
Right.
Sometimes if There's one type of malaria called cerebral malaria,
Cerebral malaria.
brain malaria, falciparum malaria.
Right.
So these are the subgroup of malaria patient
Right.
in whom the brain is involved.
Okay.
So these patients should be treated very aggressively. In ICU, sometimes they may become unconscious. They may have to be put on ventilators and all. And there are many people who die with cerebral malaria.
Yeah.
Unless you are aware of this fact, every malaria is not simple malaria. At the same time, if you are having simple malaria, you need not even go to the doctor. Many patients go to medical shop and take medicine and be done with. They become all right. So that is the complexity of our profession. Okay. Dr. Moin, you must have seen many.
Yeah, I have seen some patients who treat themselves, and I have seen some patients who land in emergency saying that I have used the course of medicines, but I could not get treated because they have taken the wrong, treatment for their malaria. So now, sir, there is another problem, typhoid. Many people have fever and then they just go for the testing. They do that Vidal testing, right?
Yeah, Vidal is one of the tests, but it's not a very specific test. We have cultures, we have immunological tests for these days for typhoid. The Vidal is a good old test, but it's not very specific.
Okay.
It can be positive any other disease.
Mm-hmm. Yeah. So, what do you test, sir, if somebody has typhoid?
Yeah, actually, the gold standard test is the culture. Culture of blood culture or the stool culture.
Okay.
To really confirm the typhoid.
Whether it is
but
typhoid.
Again, these tests will take at least 2 to 3 days time.
Okay.
But if clinically you are suspecting strongly, we have some indication on examination on history.
Okay.
We have some indication saying that this patient could be a strongly positive case for typhoid.
Okay.
In which case, without wasting time, you can start off anti-typhoid treatment.
Okay.
You'll be right.
And you can meanwhile get them tested.
Exactly.
Okay. Dear friends, so time is very precious. Whenever you have fever, just don't take it for granted. Like there is malaria, which is different, typhoid, which is different. So stitching time saves 9. You have to meet the physician whenever there is fever. Another problem, which is called dengue fever. Sir, what is dengue fever? I heard dengue is very fatal and it's like very cumbersome. How do you help our viewers?
This dengue fever was unknown to Indian population 10-15 years back.
Okay.
If you remember.
Yes, sir. Yes, sir.
We were reading only in the books and hardly we could.
We never saw those patients while we were,
exactly.
Doing medical school.
Yeah. For the last 10 years, it has come from different countries. Like any other disease, it travels from one country to another country.
Okay.
So dengue is a viral disease. It is transmitted by mosquito.
Right.
The mosquito is Aedes aegypti.
Okay.
It is also called a tiger mosquito.
Okay.
When you can see it, you can see if the mosquito.
The size of the mosquito is big.
It's little big and it has a stripes like tiger stripes on the body. You can make out visible. You can with naked eye you can see.
Did this mosquito travel from Egypt or from some other country?
No. The name of the mosquito is Aedes aegypti.
Okay.
So this is responsible carrying the dengue virus. In dengue virus we have 4 types: dengue 1, den 1, den 2, den 3, den 4.
Sir.
4 types of viruses are there. So it is a mosquito-borne disease where the patient will have fever, vomiting, diarrhea, abdominal pain, and severe body pains. We also call dengue as a break-bone fever.
Do they have rashes as well, sir?
They do. Some of them have rashes if the platelet counts are going down.
Exactly. When they have rashes, it's a very crucial thing for you to understand that something is not right. As sir said, your platelet count is going down, then they develop rashes and all. So it's a very crucial time where we should consult a physician. And what would you do, sir, when somebody has all the compilation of symptoms, especially with rashes, platelet count down?
Yes. Again, platelets, the main function of platelets in the body is, we all have micro trauma going on in our body every day, 24 hours.
Right.
Everybody, micro trauma, because the blood is circulating. What platelet do is, what is the function of platelet? Hemostasis.
Right.
Hemostasis means they go and just plug the leak wherever the micro leaks.
Yeah.
It's happening in
doesn't let blood come out. Doesn't let bleeding happen. Right.
Yeah, it's something like that.
Right.
But what platelets do is they go and seal off the leakages. This is called hemostasis.
Right.
It is happening in everybody.
Right.
Only when the number of platelets go down, in many diseases, example is dengue fever. So this stopping the leaking blood mechanism gets disturbed. You get rash. And sometimes the count go down, you may get nose from the bleeding from the nose, bleeding from the gums, urine, sometimes intracranial,
Cerebral.
in brain bleeding or in the abdominal bleeding. The bleeding complication do come when the platelet come down to drastically low levels.
Okay. So their main symptoms, we came to know that fever, they may have rash, body aches. Sometimes you don't know the rashes. Sometimes you might be bleeding in the abdomen,
Yes.
cramps and all. So all these things, all these symptoms are for you to watch and take all precautions. Stay away from mosquitoes, keep mosquitoes away from you, and whenever you have some problem, you can always consult a physician.
Yeah, one point, Dr. Moin, about these mosquitoes. These mosquitoes are very disciplined mosquitoes.
Oh, is it?
Yeah, more disciplined.
When we are not disciplined, I am surprised to hear that mosquitoes are disciplined.
What I mean by discipline is,
Sir.
they don't bite you in the nights. They don't disturb you.
Oh,
They're
is
the
it?
daytime biters.
Okay.
And they have a proper meal timings like breakfast and dinner. They bite, their biting timings are from 7 a.m. to 10 a.m. in the morning and again 4 p.m. to 7 p.m. in the evening.
Okay.
And if they bite one person, unlike other mosquitoes, they don't bite other person immediately because they are full.
Okay.
Their stomach is full.
Okay.
They don't bite another person until they feel hungry in the evening again.
Okay.
So that is the beauty
Of this
if you allow me
mosquito.
to call
I just heard that the tiger and the lion are so royal that once they have their meal, they don't harm others. They don't go for another meal.
Exactly.
Looks like they have the similar.
So, taking a lesson from the characteristics of this mosquito, we should be also careful during the daytime.
Okay.
Especially when we are careful in the night, we put the mosquito coil, we put the mosquito nets, we try to close the doors, close the windows and all. But when you are working in your office, in your workplace, in your train, in your bus, they may come and bite you. You should be extremely careful because they are the daytime biters.
Okay. So, what precaution they can take? For example, if they are traveling or they are outside, or even if they are at home, some repellent will protect them, or some
Whatever
cream or
whatever measures you want to use, that's up to you. Repellents, we have coils, but there should be very, very careful. The smoke, sometimes they get, some people are allergic, they will get allergic symptom.
you may have to meet an ENT surgeon then.
So all mosquito measures you have to take.
Okay.
And if there any surroundings around your house are having any puddles or even the broken coconut pieces can invite the mosquito.
Right. The only thing is you should not let any water get clogged around your surroundings so that they don't live there, they don't breed.
Exactly.
So government is taking so many steps to stop this breeding of mosquitoes. Probably you may also come forward and help your surroundings.
Welcome.
And sir, there is another fever where you just come across when somebody has tuberculosis. How different is that fever, sir?
Again, tuberculosis has a very atypical presentation, you know. When you ask general public what is TB, they say fever, cough and sputum, that's all.
Okay.
So, TB is such a disease, it can occur anywhere, it can involve
Anywhere in
any
the body.
part. But TB is a whole body disease. It can affect any part of your body except your hair and nails, probably nails also.
Okay.
So it can involve your lungs, your heart, your brain,
Bone.
your eyes, your nose, your throat, your kidney, your bones, your skin, everything. So it depends. The presentation depends on which part of the body is involved. For example, if somebody has TB of the lungs, they may come to you with cough and sputum. And if somebody has a TB of the joint, they come with joint pains. If somebody has, it can involve brain, meninges. We have seen patients dying of brain TB.
Right.
When TB meningitis.
Okay.
So the presentation is very variable. India being such a big country, still we have a problem with TB. Still we come across TB patients coming to us with different. TB can occur in the abdomen, TB can occur in the lymph node, TB can occur in the kidney. We have seen kidney. And TB can also occur in the uterus. Young couple married after 1 year, 2 years, 3 years, they are not having children. When we do investigation, we found that they have TB in the uterus. And after treatment, they become all right and they started producing children. So TB can occur anywhere. And depending on the area of involvement, that symptoms are, there's no specific one symptom to say that you have TB or you don't have it.
Yeah, it's very informative thing, sir. Like I just came across a patient who was having ITB. I didn't know why is it so. I was just going through so many books, literature and all. Then I just came to know that the manifestations of ITB are not very well publicized. And in our country where we have lot of patients with TB, you may have TB anywhere in the body.
Yes. TB uveitis. Uveitis, we have seen treated many patients of TB uveitis. Yes, it can, and it is treatable. TB, if you detect early any part of the body, it is treatable because we have specific treatment. Only thing you have to diagnose the proper time at the earliest so that the treatment is beneficial. But it's a prolonged treatment, minimum 6 months to sometimes 1.5 to 2 years also we give depending on the site of involvement.
So these are the general problems which you come across in your daily life, and you may be having fever. These are all the few types of fevers we just wanted to enlighten all our viewers. Thank you so much, Dr. Vijayamohan, for spending your valuable time with us. Thank you, sir.
Thank you, Dr. Mohin. Thank you very much.
Welcome to Med Talks with Dr. Mohin.